Is Wellington Thomas. He's the lead ER tech at Loretto Hospital in Chicago. Wellington, good morning to you.
Good morning. How are you doing?
I'm doing well. I want to transition straight from what we heard from the president into your reality. And guys, if we have the sound, I want to hear from the president yesterday talking about the reality that from his perspective of PPE, the personal protective equipment inside hospitals. Watch this exchange with Jim Acosta.
You and some of the officials paint a rosy picture of what is happening around the country. If you look at some of these questions, do we have enough masks? No. Do we have enough tests? No. Do we have enough PPE? No.
Why would you say no?
Do we have enough medical equipment?
The answer is yes. I think the answer is yes. Who said no to that?
I'm saying this.
No, you're saying no. But who said no? But you asked me, do we have enough masks?
We hear from
yes.
Doctors, we hear from
No,
health
you didn't
experts.
say that. You said, do we have enough masks?
Does the country?
Yes.
The president says to the question, do we have enough masks? The answer is yes. What's your reality?
Well, the reality is, I don't feel that we have enough masks. Currently, when you work in certain departments, you run through masks every day. You're running through them when you go to each different rooms, and you can use 3 or 4 masks, depending on what type of patient it is, easily. And then on top of that, you have the different type of mask. For myself, I'm a bigger guy, so when I put on an N95, it's not even the right size, so I have to struggle with using 2 masks to just try to protect myself.
Wellington, have you been forced, as we've heard from some others, to reuse equipment at any point? And are you ever afraid to go to work?
Well, at times I am afraid. I will say this: we are forced to reuse our shields. Sometimes certain isolation gowns we do use over just because of the shortage. We're doing our best. We could be in a much worse position right now, but we're actually trying to sustain. We are getting donations at times, so that does help us out. But I would say that we're going to continue to need more masks. We're going right through them. And not only that, we're also taking care of visitors, family visitors, and other patients that come in the door that's walk-in. So not only ourselves are using them, but our colleagues in the whole building and also other people that come through.
Wellington, let's expand the conversation broader beyond the PPE and the masks to what life is like there. You told one of my producers that Loretto Hospital was struggling before COVID-19. Just give us an idea of some of the challenges now that you face additionally because of the outbreak.
Well, Loretto Hospital is a safety net hospital, so right now we rely on a lot of different financial assistance from the government. Over half of the financial money that we get is from the government. So we was already struggling as it is. We serve a community that doesn't really have enough money to take care of their bills. So we already having problems. But now with this COVID, we over here trying to go to Springfield within our state to try to get more money, which we've been fighting for with the union. But unfortunately, with COVID hit, it makes us go 3, 4 steps back. And now the state trying to assist, the hospital is trying to get assistance from other people, and it's putting in wear and tear on us. And on top of that, we're trying to get hazard pay because workers, like you said, it's hard to come to work. They don't want to come to work because they're afraid. You see how people dropping like flies, and unfortunately, the workers are afraid to come in here because they're at the highest risk.
So I know that workers are also, they say they're being denied testing. Have you asked to be tested? Have you been denied it?
Well, what we've done was, as far as in our facility, they're only testing people who exhibited symptoms. I know colleagues that wanted to get tested, but until you get the symptoms, they don't want to test you. Unfortunately, because of the test limits or how many tests we have in the building, it limits us. So they want to just use those for our patients that exhibit symptoms or even coworkers that does. But there is a lot of workers that, like you said, are afraid and they actually want to get tested because they've been in an environment, patients get transferred to other floors. And when they go to these floors, 2 or 3 days later, they find out that they're positive. Mm-hmm. And you have coworkers that's been on it, particularly in the, one of our behavioral health units or, around the building. Yeah. But thank goodness it's as bad, but it's definitely starting to climb.
Well, Wellington Thomas, lead ER tech at Loretto Hospital in Chicago, thank you for the work you are doing. And from what you've told us today and from what we've seen across the country, we understand that it is under especially difficult circumstances. Again, thank you for your contribution to fighting this pandemic.
We appreciate you, Wellington.
Thank you.